thanks for joining us. I thought 2 months after the outbreak in Mexico, it's good to just take stock and share my perspective on this outbreak with everybody. But 2 months later, it has now become global pandemic. The North American countries, US, Canada, they are less lucky because they were so close to ground zero. So they really had no opportunity to try to contain the outbreak. And the virus just went into community spread very quickly. Whereas down here across the ocean, the Asian countries had 1 week, at least a week, to gear up, to activate the various containment measures at the borders. And they, by and large, put up a very robust response to try to slow down the virus spread for a few precious weeks of preparation time, even though we all knew there's a matter of time when there will be community spread. Australia, Japan, New Zealand put up very strong containment measures and managed to hold up the virus at the borders for about 1 month. Very, very credible performance. But eventually the virus still slipped into the wider community, and the number of infected cases there just simply grew exponentially. You may remember that in 2 weeks, Melbourne alone saw figures soar by 1,000 patients within a very short period. And then they, in turn, became a source of many exported cases. If you look at our data, half of our exported cases came from Australia, double the number from US. From our point of view, analyzing our own imported cases, we see 3 waves. The first wave was from America, and then the second wave from Australia. For us, the second wave was a bigger wave, purely because the travel volume between Australia and here is a lot higher than the travel volume between North America and Singapore. And now you will notice, starting from last week, a third wave, which is from our fellow ASEAN neighbors, particularly Philippines and Thailand. I think because of our close proximity, we should anticipate that this third wave may in due course become a big wave. Against these challenging circumstances, Singaporeans are putting up a very good fight against the virus. Many took our advice and behaved responsibly. Many infected cases, because each time when we report the cases, we let you have the details, and you knew that many sought early treatment and did make use of the 993 ambulance service. And many more people, more than 1,000, put up with the inconvenience of home quarantine or quarantine at Aloha. We are all very grateful to them for their social spirit. As a result, we have bought ourselves valuable time. We can be very proud of our achievements. For 7 weeks, there was no local transmission. All our confirmed cases were imported. We were able to track down every imported case and every of their known reported close contacts and isolate them promptly. By now, we have contact traced more than 1,000 people and quarantined every one of them. Our contact tracing teams work very diligently round the clock, 7 days a week, to track down every known contact of the patient. They deserve our praise. However, we know that eventually we will also have community spread here. Some patients don't have symptoms at all, and they can go around infecting others without them knowing it. This is in the nature of influenza virus, and that's why it's so contagious. And it is not because these people are irresponsible. I think let's not blame them. Last week, we have the first sign of community spread, and over the weekend, the signs have become more prominent. By now, we have 168 confirmed cases. Now it's 26 more than what you just heard from Lee. Local, we do not know of the 26 how many are local spread, how many are imported. That is still being examined and analyzed. But if you base on the up to yesterday's data, of the 142, 24 you heard were community spread cases, so that is 17% of the total confirmed cases. This percentage is worth monitoring because that will help us determine what is the extent of community spread. From the experience in Melbourne and also elsewhere is, I think we have crossed a tipping point beyond which the community spread numbers will just simply grow, magnify in very rapidly. And this may well happen over the next few days. But our objective remains unchanged, which is to minimize casualties. But as our circumstances change, we must change strategy as well as tactics. When the number of cases is low, so we put a lot of resources tracking down every known close contact and try to isolate them. But once the numbers escalate, we have to shift our resources to focus on detecting and treating infected cases, paying particular attention to high-risk patients. These are the adjustments that we have been making the last few days, and we will continue to make over the next few days. They correspond to a shifting of our alert level from yellow containment to yellow mitigation. The transition will not be abrupt. We will do it gradually, and of course, the pace of it will be guided by actual local epidemiology of the disease. So let me elaborate on what are some of these adjustments that we can expect over the next few days. First, we will take a much more focused approach to contact tracing. So far, most of the contact tracing pertains to air passengers sitting close to confirmed cases. But with community spread, the likelihood of infection has now shifted to the local community instead of only in the aeroplane cabin. So we have started to scale down such contact tracing. Contact tracing henceforth will be decided on a case-by-case basis by our public health experts, taking into account the medical condition of the infected patients while they were on board. Isolating close family members of confirmed cases, however, remains a useful control measure. Likewise, temperature screening at borders remains useful. We know this is not foolproof, but it is useful. If you look at our cases, 1 in 4 of the confirmed cases, imported cases, were picked up by the scanners. Second, we have ramped up our laboratory facilities. So by now, all our major hospital labs are capable of testing and confirming H1N1. Third, we have geared up all our public hospitals to handle H1N1 cases. 993 ambulances have begun sending suspect patients to all public hospitals and not just Tan Tock Seng and KKH. We have also refined our workflow. 993 ambulances now send the majority of the suspect cases judged by the doctors to be mild to go home after their swabs have been taken. And the patients can then rest at home while they wait for the lab results. I think this has made the experience much more humane for these suspect patients. I, of course, expect such people to behave responsibly and to rest at home while waiting for the results, since they are clearly unwell and they really should not be wondering about. Fourth, as we need to create capacity for H1N1 patients with comorbidities, we will be refining the treatment protocol for infected cases. Not all patients need to be hospitalized. If we look at the experiences in North America in particular, because they have longer history of dealing with these patients, the vast majority of the patients, in fact, are just sent home with antivirals, and only very few are hospitalized. Many will simply be put on antiviral treatment and be home quarantined and asked to monitor their condition. We will also review the use of Tamiflu for close contacts of confirmed cases. Fifth, we are gearing up our polyclinics and a few hundred GPs to treat suspect H1N1 cases. We call them PPC, Pandemic preparedness clinics. A bit of a mouthful. I would have preferred to call them just flu clinics. But they can be recognized by their decal with a tick mark and with a ready marks to show that they are ready to handle walk-in suspect flu cases. And they will only refer some categories of high-risk suspect patients to public hospitals. We will use the next few days to publicize to Singaporeans where are these PPCs and according to where you live, where you work, so that you know in case you develop some flu symptoms and you know where to seek advice. When the local biosurveillance data confirms significant community spread and we need to move from containment to full mitigation, we will signal to the public to use these PPCs instead of going to the hospitals if their flu conditions are mild. And this may happen over the next few days. 6, we will secure adequate supply of H1N1 vaccine for our people. Besides our existing supply contract with a vaccine manufacturer, we are also in active negotiation with other vaccine manufacturers. The objective is to diversify our supply of H1N1 vaccines because the vaccines produced by each one of them are not exactly identical. An important consideration will be which manufacturer can promise the best delivery timeline. But these are new vaccines, so they are still subject to clinical trials to ensure safety and effectiveness. So I think we should be realistic about the timeline for availability of a safe-to-use vaccine. 7th, our scientific committee, which is chaired by DMS, is actively evaluating the characteristics and the genome of the virus. The good news is that the virus here remains identical with the virus in North America. You may remember there was an earlier press report about some Brazilian claim that the virus there has mutated and was no longer the same as the North American virus. But I think the report has since been found to be flawed. So the consensus view is that the virus remains moderate risk as described by WHO. Singaporeans, therefore, really do not need to panic over this development that there is now community spread in Singapore. Almost all infected cases will be able to recover fully. Tamiflu and Relenza remains effective against this disease. But I thought I should explain that moderate risk does not mean no death. Just like the seasonal flu, there will be some deaths. The data from North America suggested a case fatality of 0.37%. What this means is that out of 1,000 cases, one should expect a few deaths. And in North America, the number of deaths has already exceeded 100. And in Australia, they have already reported their first death. And that's why we need to target the high-risk patients, especially those with underlying medical conditions, and to render them the best chance of a full recovery. And that's why we need to allow our hospitals to be able to focus on the high-risk cases and not be distracted or overwhelmed by hundreds of mild cases. Overall, last week has been eventful in the development of the outbreak in Singapore. We expect this development. We know that June will be challenging for us given the large number of return holiday travelers. But the 7-week head start has been extremely useful to allow us to gear up our system for community spread phase of the outbreak. Singaporeans should just carry on their lives normally, but do keep up a high standard of personal hygiene. WHO has a good acronym, WISE, W-I-S-E, WISE. W for wash your hands frequently, and that applies to everybody. Healthy or sick, wash your hands frequently. And remember the poster, the ugly poster with a lot of creatures on your hands. And those are maybe exaggerated, but not too far from exaggerations. And that's why it's so important to wash your hands. Apply to everybody. I is for me, is for us in government, is to keep the population fully informed, promptly informed, so that everybody knows the development of the outbreak. S and E refers to people who are sick. So S, please stay apart from others. Protect others. If you are sick, if you are unwell, the doctor has given you a sick leave, please don't go back to work and please stay at home. And E, of course, is etiquette. Your sneeze and your cough. But for people in high-risk categories, and this will include pregnant mothers, people with asthma, people on kidney dialysis, people with immunosuppressant drugs, or on chemotherapy, and also other conditions, I think they will need to be extra careful. For example, they could wear a mask if they have to go out. Over the next few days, we will publicize our advice on what they should do, to educate them on what they should do. We are considering sending them direct mailers so that these high-risk patients will be properly advised on what they can do to protect themselves. H1N1 is now globally pandemic, like other seasonal flu strains. I think mankind has to learn to coexist with it. And that's why we are carrying on with our Asian Youth Games. And of course, we'll carry on with school reopening and our National Day celebrations, and of course, F1 as well. The reopening of schools will raise the risk of local transmission from infected students who have just recently traveled. And that's why it's important to get the recently returned students to stay at home for 1 week before they rejoin their classmates. Ministry of Education will provide more details soon. But overall, life must continue as normally as possible. We will still take some targeted control measures as and when an event occurs. For example, to close a school when a significant cluster is found so as to break the transmission, or to isolate a competing team from other athletes, as we did yesterday with the Filipino soccer players, and as we did this morning with the Hong Kong soccer players.